All right. So whenever I'm out in the community, I'm talking to people about chiropractic, a lot of the time I run across the same misconceptions. So I thought I'm just going to make a video. I'm going to talk about the top 10 most common chiropractic misconceptions. But then as I was doing that and I was writing everything up, I was like, holy moly, this is going to be a really long video. So what I'm going to do is I'm going to break it into two parts. Part number one is going to be 10 through 6, and part number 2 is going to be 5 through the number 1 most common chiropractic misconception. If you could do me a favor, please like this video, subscribe to the channel, it really means a lot. Number 10 is chiropractic is too expensive. Now, I have this as number 10 because as time goes on, more and more people are realizing that that's just not true. But it's still out there and I still come across it quite a bit. So what we're going to do is I'm going to bring up some numbers and we're going to actually see, is chiropractic really that expensive? Let's look at some typical expenses that the average American spends on healthcare related things. On average, Americans spend about $100 a month on prescription drugs. Second of all, the average American spends about $450 to $1,200 a month on insurance premiums. On top of that, deductibles are ranging between $4,500 to $10,000 on average. And this is not even taking into consideration hospital visits. So there was a study that was done in 2004 that looked at what would be the repercussions of having a chiropractor be your primary care physician versus having a typical medical doctor be your primary care physician. So what they did is they took almost 21,700 people over a 4-year period who chose to have a chiropractor be their primary care physician, and they looked at a couple of things. What were the differences in hospital admissions and hospital days? What were the difference in outpatient surgeries and procedures? And what were the differences in pharmaceutical costs? And what they found was crazy. The group that had a chiropractor be their primary care physician had a significant decrease in all of the areas that they were studying. Decreases of 43% in hospital admissions, a decrease of 58.4% in hospital days, a decrease of 43.2% in outpatient surgeries and procedures, and a 51.8% decrease in pharmaceutical costs. Based on that study, it basically shows that having a chiropractor as your primary care physician actually decreases your healthcare costs, which means you're going to save money. You're going to see anywhere between $30 to $200 per visit, and that varies widely depending on where you live, the experience of the chiropractor, and what kind of technique the chiropractor is actually practicing. So basically, is chiropractor too expensive? According to the research, it's not. It's actually cost effective. Number 9, all chiropractors are the same. Now here's the thing, I don't actually hear people say that specifically, but what I hear is this. Oh, I've been to the chiropractor before, it didn't really help. And they tell me some story about a chiropractor who just didn't really do that great of a job with them, or whatever the case may be. And then I ask them, well, did you go get a second opinion? And they're like, yeah, I went to the neurologist. I mean, did you get a second opinion from another chiropractor? No, I tried chiropractic and it didn't work. A lot of times people just don't realize that there's over 200 different chiropractic techniques. Now, granted, there's 10 to 15 that are most commonly used, but a lot of people don't even know that. They think that what they went to was what chiropractic had to offer, and if it didn't work for them, then they just dropped chiropractic altogether. It's kind of like saying, I tried exercise, and it didn't really work for me. So, what, you're just going to never exercise again? I've been to my primary care physician, and that really didn't help, so I'm just never going to see a primary care physician again. No, you got to go get a second opinion from that same profession, just to see that if what they're doing actually makes sense to you or not. Chiropractic, along with every other profession, is a science, a philosophy, and an art. And because it's an art, everybody does art a little differently. Sometimes people really gravitate towards one kind of art versus another. So here's my advice. Have your chiropractor clearly explain these 5 things. What are they looking for? How are they looking for it? What did they find? What are they going to do about it? And what should you expect moving forward? Because the fact is that your health is in your control. And that's why patient education is so important. So no, not all chiropractors are the same.
You want to tell people to like and subscribe?
Like and subscribe. No, the camera's that way. There. Like and subscribe. Chiropractic isn't for pregnant moms. This is a really important thing to bring up. Whenever my wife and I are out in the community or we're talking to friends and we find out that somebody's pregnant, the first question that she asks them is always, are they seeing a chiropractor? And most of the time they say no, and a lot of times they're just confused. Sometimes they say no and it's because they're scared of going, but that fear is rooted in a misconception that just isn't true. There are some chiropractors out there who devote their whole practice to pregnant moms and babies. There's a whole technique of chiropractic that is all about the pregnant mom. It's called the Webster's technique. There's several research articles out there that mention the importance and the effectiveness of having a pregnant mom be underneath specific chiropractic care, and especially in the Webster technique, which is basically all about aligning that pelvis and that sacrum so that there is minimal to no stress put onto the uterus, therefore put onto the baby. And when less stress is put onto the uterus and to the baby, there's significant pain reduction and there's significant comfort and increases in quality of life for that pregnant mom. Another really important thing about chiropractic and pregnancy is that a lot of women suffer from a breech pregnancy. That means the baby is actually stuck in a very improper position, and it makes it very difficult for the birthing process to move forward. And one of the cool things about the Webster technique is that it's been shown time and time again to actually help with that pelvic alignment and that sacral alignment, putting less stress on the uterus and allowing that baby to actually remove itself from that breech position and go into the vertex position, which is the exact place that the baby needs to be in order for the birthing process to go smoothly and without any interruptions. Obviously, one of the most common complaints that pregnant moms present with is low back pain, and that's understandable. Your center of gravity starts to change and you're carrying this whole other human inside of you. So being underneath chiropractic care not only is really great for the uterus and the baby as far as the alignment of the pelvis and the sacrum, but it's also just great for pain relief. When a pregnant mom is experiencing pain, what's going to happen is that their sympathetics are going to be in overdrive. And when your sympathetics are in overdrive, because you're in pain, you're feeling like you're in danger, that puts more and more strain onto the uterus and to the baby. So having the pregnant mom actually have decreases in pain and increases in quality of life isn't just a great thing for mom to be pain-free, but it's actually really good for the baby. The less pain and stress that the mom is under, there's a high likelihood that the birthing process will actually be smoother, and therefore there will be less stress on the baby and an increase in quality of life for the newborn. And when the newborn has an increase in quality of life, the whole family has an increase in their quality of life. So can pregnant moms be under chiropractic care? Absolutely, and they should be, because it's really good for them and it's good for the baby. So that brings me into number 7. Chiropractic is not for babies and for little ones. In chiropractic college, our curriculum actually includes pregnancy and pediatrics. And actually, there is fewer people on this planet that need chiropractic more than a newborn baby. The reason for that is because the birthing process is extremely traumatic, not only on mom, but also on the baby. Is an immense amount of strain and stress put on one of the most fragile parts of that newborn baby, the neck. So when a baby gets ready to enter this world, what is the first thing it goes through? A bunch of pulling and twisting and yanking on its head and neck. And that's a normal pregnancy. That's one without any complications. That's not even considering the fact that some of them have to go through forceps or vacuum suction. Again, there's a lot of research out there that shows that chiropractic care is great for newborns, infants, pediatrics of all kinds. A lot of times people's fear when it comes to having their baby adjusted is because they think that they're going to adjust the baby just like they adjusted them, or like they've seen other adults get adjusted. The amount of pressure that you use to adjust a baby is about the same amount of pressure that you would use to test the ripeness of a tomato. So I'm going to mention 2 research articles that I found. The baby in this first article was 2 months old and was actually deemed failure to thrive. And her family had lost hope. Had a traumatic birthing experience that included forceps and suction. And because of that suction cup, the baby actually developed what's called deformational plagiocephaly. Basically, the skull of the baby was deformed because that suction was pulling on the cranial bones, and it actually completely deformed the shape of that baby's head. This baby had a whole host of symptoms: inability to gain weight, persistent vomiting, constipation, inability to sleep, irritability, decreased hearing, acid reflux, and apnea. The baby had been experiencing this since birth, and this is 2 months later now. The baby was given Zantac as far as medical intervention is concerned, and it didn't really help. So the family took her to see a chiropractor. And the chiropractor, after a thorough exam, found several vertebral subluxations throughout the baby's spine. The adjustments that were given were contact-specific sustained pressure. So basically what that means is the doctor found the bone that was misaligned and just put his finger in sustained pressure on the side of misalignment to gently guide that bone back into proper alignment. Gentle alignment of the cranial bones and the sutures were also performed in order to help with that baby's deformed skull. After the first visit, the baby saw immediate improvement, and after 30 visits, the baby was completely back to normal. From failure to thrive to completely back to normal as a healthy, thriving little baby because of specific chiropractic care that was gently applied in the right areas at the right time. This next study was about a 2-week-old baby boy. His main complaints were breastfeeding difficulties and plagiocephaly. Again, plagiocephaly was that deformation of the skull which probably came about from the birthing process. One of the things they found was that the baby's head was just stuck. It didn't want to turn its head to the left. After a thorough chiropractic exam, the chiropractor found several misalignments or subluxations in that baby's spine. One at the very top here on the right, a couple in the mid-back, one at the very bottom, and obviously the cranial bones were out of whack. So what the chiropractor did was he did what's called a digital touch and hold, which is basically the same thing as the other one. He did a sustained contact with just the pads of his fingers. He also used that same technique to gently shape and mold the baby's skull back to its proper shape. Because of what this chiropractor did, this baby's breastfeeding difficulties were gone, and the plagiocephaly returned back to normal. So the question of, is chiropractic really for newborns and babies? The answer is absolutely. And frankly, no one needs it more than the newborn. And when their baby is properly aligned from the very beginning, it sets that baby up for success in the future to be healthy and thriving. So number 6, chiropractors aren't real doctors. So usually when I hear somebody say something like that, I always ask them, why do you think that? And these are the most common responses that I get. Number 1, you can't prescribe. That's true. Usually a lot of people think that what makes a doctor is the white coat, the stethoscope, and the prescription pad. The reason why chiropractors don't prescribe is because, first of all, we don't have to prescribe and we don't want to prescribe. So the curriculum between the chiropractic college or the medical school actually looks very similar up until the point we start talking about treatments. Our version of a treatment is the chiropractic adjustment. Instead of being taught how to write a prescription and what prescription to write, we're taught how to deliver the adjustment and where and when that adjustment is appropriate. Another common response that I get is people think that the chiropractic college is like a 1-year program or like a 6-month certificate or something. I'm getting that less and less nowadays, but it used to be a pretty common thought. Chiropractic school is actually very similar to medical school. It's about a 4-year degree, roughly the same amount of classroom hours, a little bit over 4,000 classroom hours. The only difference is that chiropractic college does not offer a residency. Another response that I usually get is that chiropractors are only taught how to diagnose things that are musculoskeletal or spine and muscle related. And that's just not the case. As a chiropractor, we're actually deemed portal of entry physicians. Basically what that means is that I need to know everything that the typical primary care physician knows, because I need to know when something that's walking in my doors is actually a red flag that I need to send out somewhere else. We're highly equipped to diagnose whatever it is that may be walking into our doors. And whenever something that walks into our doors is out of our scope, we need to know that, and we need to know where to send them, exactly like a family physician or a primary care provider would. As a chiropractor, we're licensed and able to order advanced imaging, and we're taught how to interpret those advanced imagings like MRIs, CT scans, and so on. We can also take and interpret x-rays, and we're responsible for everything that's on that film, just like any other healthcare provider. So our chiropractors are actually real doctors. Yes, they are. And all 50 states, along with almost every other country in the world, recognizes that as well. In the next video, I'm going to go over the top 5 most common misconceptions of chiropractic that I see on a very regular basis. If you like this video, don't forget to hit that like button on the bottom, subscribe to my channel if you haven't already, and have a wonderful day. Full room to grow and to move so that there's no This is tough.